idea of where we are with the outbreak here in Westchester County, sort of a local view of things. Each day, generally at 11 o'clock, we're having a Facebook interview with someone that's somewhere deeply involved in this issue. Today, we met with Matt Honeycutt from Feeding Westchester. Tomorrow, we're going to be interviewing the mayor of Yonkers, Mike Spano, and having that conversation on Facebook Live at 11 o'clock. Our status today on Tuesday, April 6th, continues to show the growth in the issue, the contagion, and the death total, but it does appear to be slowing some. It's very hard to draw broad-based trends this soon, so I would caution everyone to take all of the numbers with a grain of salt. But today, New York State has indicated that Westchester County has 14,804 cases that have been tested positive for the COVID-19 virus. That's out of a total number of tested of 46,701, and that's a very encouraging sign. It's better than a 2-to-1, better than a 3-to-1 ratio of positives to negatives. 14,000 testing positive, and then 32,000 testing negative. That we think is a very good set of numbers. We're very comparable to the other suburban counties in New York State. Nassau County has 16,000 positives. Suffolk County has 14,500 positives, and their testing numbers are well below ours. Nassau County has tested 10,000 less than we have. Suffolk County has tested 13,000 less than we have, which means that as their testing numbers go up, then positives may go up as well. None of this is encouraging, and we're not, as I often say, we're not in a race to see who has the best record in the NBA. We are three somewhat comparable counties. Both Nassau and Suffolk are larger than us. New York City certainly is larger than all three of us put together, and they're having the highest level of contagion around the state. Statewide, the governor announced 138,000 people have tested positive for COVID. The more critical factor is that 283 Westchester residents have died due to the coronavirus issue. 500 have died in Nassau County. Statewide, 5,489 have perished because of this. It's important to look into perspective. The total number of positives aggregates all the tests that have been taken since we began testing slightly over a month ago. So 2 weeks ago, we had 4,691 cases that were positive, which means that over the course of the last 2 weeks, those 4,000 people have either taken seriously sick, may have passed away, or have managed to go through the 2-week period of time that's necessary to determine that they are free of health issues relating to the virus. When we subtract that number from our current total number of positives, we get a number that we think is the working number of active cases in Westchester County, and that number is 10,113 cases. It is encouraging that so many people who tested positive for the virus have apparently overcome the virus, and that was as we were advised by the healthcare professionals that at least 80% of the people having had the virus would be able to fight it off given their relative strength of their immune system. We have right now 1,056 people hospitalized who are Westchester residents. That number represents, again, about a tenth of all the cases. So we have a hospitalization rate now of 10%. The general number that we're concerned about is when we hit the 20% ratio. When we hit 20% of all the people that have cases, active cases, then we begin to concern ourselves about, do we have enough hospital beds to take care of these individuals? And then by extension, do we have enough doctors, nurses? Do we have enough personal protective equipment? And then ultimately, do we have enough ventilators to keep some of these folks alive during the period of time that they are fighting for their life? So a 10% hospitalization rate is still well below the concern number, which hits about 20%. In addition, with 283 fatalities, our fatality rate when compared against our total number of people that have tested positive is under 2%. It's 1.9%. That is a bad number, no matter how you slice it, but it could be much worse when people have projected that the fatality rate could be much higher than that. It could be 3% or as high as 7% in certain other parts of the globe. When we look at the numbers overall, if we can maintain that 10% hospitalization rate, and if the vast majority of those people recover, then we will weather this as best as we can. What we're looking at right now is the availability of 3,000 hospital rooms in Westchester County, slightly above that, the opportunity to bring online another 1,600 hospital beds, 100 plus of which would be at the county center. And that would be, in round numbers, 4,500 beds available for patients who need them at the point of crisis. If we maintain a 20% ratio, which is the higher level ratio, as opposed to the where we are now, 10%, we would have enough beds to get us through the surge based on projections. But these are mathematical numbers. They aren't real world numbers. And so we may see the contagion grow and take another leap forward. For right now, the percentage numbers give us some confidence that our available hospital beds can handle the level of contagion that we anticipate, but no one can predict how it all plays out. We have lowered the flags in Westchester County government to half staff. You will see it on county buildings and on county parks, other facilities that we have. It is out of respect to those that we've lost from the coronavirus. They will stay lowered through the whole extent of this contagion. Only the governor or the president can order all flags to be lowered to half staff, but we've done it on our facilities, which we're appropriate to do. And other communities, Village of Ardsley, for one example, has lowered their flags to half staff as well, as a symbolic sign of our respect for those that we've lost. One of the things that will get us through this crisis is the volunteer spirit of all of us as Americans in general, and then, of course, those of us who live here in this home county. We've been all very blessed with many good things. Those of us who are healthy at the moment, good health, families and resources, careers, and so forth. We have put out a call for volunteers with medical experience that would help us through the needs that we're going to have for medical personnel to deal with the cases. We've gotten 126 nurses, 17 doctors, and 13 students in a variety of medical health areas that have volunteered. They've signed up. They've contacted Lindsay Jackson, our point person on this issue, lajc@westchestergov.com. And those individuals will be put into service to help us manage the healthcare side of this as we go forward. This will most likely coincide with the availability of the Westchester County Center as a temporary hospital facility, which we expect the work will be done probably about a week from Friday. If you pass by it now, you'll see tents outside. There'll be some beds in the tented area. There'll be some in the building. And we believe it'll get us another 100 and so beds. But we also need the healthcare staff to do that. And that's where these volunteers will come into play. We're also looking for volunteers to help us on the economic development side. Bridget Gibbons, the head of our economic development team, is working to put together a trained group of volunteers that will help small businesses be able to apply for the SBA loan programs made available by the federal government. There are 3 programs right now. 2 of them are SBA economic injury disaster loan programs. One is a regular loan, the other is an advance on the loan. And the third one is the Paycheck Protection program, and that provides loans to businesses to cover payroll expenses that they've incurred due to the coronavirus. None of these programs are easy to automatically file the paperwork on. If you're a small business owner, the paperwork might be an obstacle for you to actually compete for the money that is potentially available to you. So we're putting together this trained group of volunteers. Their mission is to be able to understand the program, understand how to fill out the forms, and then be helpful to the individual business person once we roll this out. We're going to be working through not only Bridget and Deb Novick, her assistant, but also Shari Rosen Asher, who is on our team, and she's involved directly dealing with chambers of commerce. And our outreach to the various chambers will be to have them let their members know that there is a place to get assistance, and that assistance will help them hopefully access federal funds, which will keep them going. In the spirit of volunteerism, we also want to give a shout out to all of our first responders. We have seen the usual exceptional work that they've done on display once again as we go through this crisis. And our definition of first responders, because this is a medical crisis, has expanded. We generally refer to police, fire, and EMS when we talk about our first responders, the people that come out to a call to help protect a person or property, either from fire, from their medical health issue, or anything that a police agency would enforce. We also want to include our healthcare professionals, our nurses, our various technicians, and the medical doctors, medical professionals. This whole group of first responders put themselves in harm's way for us. And as we've asked volunteers to step forward in the medical area, we've asked for volunteers to step forward to help us help small business process loan applications. We want to be sure to thank these people. And there are ways that you can do that. Very simply, you can record a message of thanks and put it up on your social media. If you have Twitter, if you have Facebook, Instagram, any of these other tools, send it out to your friends and just say, I want to stop and thank the police, the fire, the EMS, and the healthcare workers for what they've done. It is really exceptional work. You can go to hashtag MyWestchester, or hashtag WC thank you if you'd like to see a little bit more about this. We think all that is extremely important. We know that there is a spike in domestic violence issues as we go through the current amount of sheltering. People who are out of work right now, people who are in confined settings in their home areas. Many times this exacerbates issues that have become part of the domestic violence problem. We don't believe that any individual should suffer in silence, that they should seek help. There's a host of different agencies that can provide that help. Hope's Door, Legal Services of the Hudson Valley, the Loft, Family Justice Center, My Sister's Place, Make the Road, Pace Justice, on and on and on. I'm going to give you a simple place to call Monday through Friday from 9 a.m. to 5 p.m. And that is our Westchester County Office for Women. Robbie Schlaff is the head of that office. We have a number of people who work out of that location. It is a 9 to 5 setting, but jot the number down and you can speak to them and they'll give you more information about other places you can go to seek certain kinds of help and advantage. Their phone number is 995-5972. And if you're a Spanish speaker, 995-6581. But the general number is 995-5972 for those that can help you in issues of domestic violence. We continue on all the other issues that we've updated you on before. I've already mentioned the county center. Glen Island continues to be a source of testing. We continue to have testing going on at Westchester Medical Center. We continue to push for the maximum amount of testing possible. Our emergency operations center continues to take orders for PPEs and hand sanitizer and get those material where they can best do the good out in the community. We've already mentioned that we have received a mobile unit that will help us with fatality management. The huge number of those who have passed away in a short period of time has taxed the normal system of burial. And so now we have to step in and be helpful to those entities with our efforts as well. I've also mentioned almost every day, caught myself every day with our park situation. I need not repeat it all again. Our county parks are open. Right now, we are opened for what is still the remnant of the winter season, and those parks and nature centers and trailways, golf courses are included, that still allow for social distancing and recreation. We have not opened our more active parks at this point. Normally, we would not do that until May and June anyway. There's quite a doubt that we're going to open any of them on time, and there may be a possibility we don't open any of them at all this year. It depends on the spread of the contagion. But we can differentiate those facilities that have active usage in a certain way. We know that we have active usage at Playland Amusement Park, and people would be close together when we open the gates. We know that we have that on our beaches like Glen Island and Playland and elsewhere. We know that that will happen on our swimming pools, whether it's at Sprain Ridge, Wilson Woods, Saxon Woods, Playland, any of the other public pools that we have. We know that the ethnic festivals that we have at Kensico Dam Plaza attracts thousands of people in close quarters. And those usually begin sometime in the late spring and they go on until August. And we have a few of them also held over at Ridge Road Park in the town of Greenburgh, same scenario. And we are not prepared to advance those types of park activities because we know they're going to be unmanageable from the standpoint of social distancing. So I've ferried these issues back and forth. I understand there's certain people out there who don't want to see any of the parks open. There's some people who don't want to see just golf courses open. We have made the decision to keep them open based on best medical advice and on the practical assessment of what types of activities will most likely involve people in close quarters that would spread the virus versus those activities that can be safely conducted where people are socially distanced and we can maintain the proper degree of control, such as we have any control over the spread of the virus. And I gather there are people who disagree and you want to email me and go on my Facebook page. You have a right to express your opinion. It is a democracy. Your opinion matters, but I want you to understand that the policy that I've taken is a rational policy based on consulting with people. It's not knee-jerk. We get to name calling and people say things that, just cool your jets. We disagree or we agree. And for those of you who think we're doing the right thing, then please express your opinion as well, because we want to have both sides represented. Different jurisdictions can do different things. There are certain municipalities in Westchester that have closed their parks. I believe the majority of them are still open. The state is still open. but different counties can open or close their parks. A lot of it depends on the demographics of the county. I know that Rockland County, right across the river, has made a decision to close their parks just yesterday, but they have a demographic reality that's very different from ours, and the decisions made there don't necessarily mirror the decisions we have to make. But that's an ongoing discussion, and I'm sure it'll continue on Facebook the next time I go to look at comments in the comments section. Other than that, we've covered, sort of the basics of what we want to touch upon. I really want these to be as factual as I can make them, as substantive as I can make them, and then let you return to the rest of your day. And if you're home sheltering in place, we hope that you take good care and you keep the safety that you and your family deserve, and enjoy the fact that we do have nice weather. There are some options for you, even though most of them are not as they would normally be were we to have our normal spring. We will never forget the spring of 2020. Let's make sure we're all there in 2021 to look back and remember the spring of 2020. So Catherine Chaffee is with us. I don't know if we have any questions from the press. Doesn't look as if there are any questions. So if there are not, then we'll certainly invite any of our friends in the press to reach us separately. They can call us directly, and we'll be happy to talk with them on any particular issue that might be considered appropriate. But we do appreciate you tuning in and watching, and we hope you have a safe and a healthy day. I'm George Latimer, Westchester County Executive. Thank you for watching, and we'll see you again tomorrow at 2 o'clock right here.